Hey there, future nurse. Now I know I'm getting ahead of myself here, but I bet you'll like this video. And if you do, be sure to head to simplenursing.com/YouTube for way more content than you can get here. And you can sign up for free. Okay, now for the NCLEX study plan. Always give yourself about 4 to 6 weeks to prepare for boards. Now this is once you get your ATT number and start scheduling the exam. Now how do you know if you're ready, and how do you know how to set up your study plan? Well, that's pretty simple. It's all about hitting your key numbers. So be sure to write this down. Your goal is to take 1,200 questions or more. The bare minimum is 1,200 questions or more, with a 70% or higher mean average. Now, technically speaking, anything above 60% on practice exams gives you a 95% chance at passing. So that's why I always recommend students to shoot for 70% or in that area. This is done to know 100% that you're gonna pass. And this is how you know you're ready to take the NCLEX. Okay, now if your numbers are lower than this, then don't freak out here. Simply push your NCLEX date back. Guys, there's no shame in that. So many times students say, Mike, I need to rush the NCLEX. I have a job offer, or my parents or my spouse want me to take it quick. So I'm like, okay, well, how are your current scores? And they say, well, it's in the 40s or 50 percentile, 2 to 3 weeks before the exam. And I'm like, no, guys, just push your date back till you get those numbers up. Now, those that don't listen to me take the NCLEX and risk failing, and honestly, most do. Now, they lose their job as well as fail the NCLEX. And honestly, I see it all the time. I've seen it actually over 100,000 times in the past 10 years doing this. So don't do that. Always be honest with yourself and be smart. Simply push your date back until you get your numbers up. You see, the NCLEX is like going skydiving. You don't want to jump out of that plane with holes in your parachute. So in the same way, don't jump to take boards with holes in your knowledge. If you're not ready, then just don't take it. Guys, don't rush it. Make sure to patch up the holes and get those scores up. Now, I see students who listen to me, put the plan in place and execute it. And guess what? They have all passed. So follow my advice and hit those key numbers. Okay, now another thing here, don't wait too long to take your NCLEX. I hear students say, I'll take my boards in 3 to 4 months. Guys, don't do that unless you've been out of school for a number of years. But if you recently graduated, then take your NCLEX in about 4 to 6 weeks. Because if you don't, you're just gonna procrastinate and not study, and I see that a lot. So before getting into the simple study plan, let me clarify for those students that have been out of school for that long time. Or if you're watching this and you failed the NCLEX before. Let's just say you failed the NCLEX a few times, and now what? Right? Does that 4 to 6 week study plan still apply? Well, the core is still true here. Focus on your key numbers. Focus on hitting those key numbers. Your plan will be a little bit different since you're going to need more content review, which we're going to cover in the simple study plan. Now, lastly, what if you have to work? I always hear this. Students are like, Mike, I got to work 4 to 5 days per week and I need to take my NCLEX. How do I be prepared in 6 weeks? So for these students, I always tell them, you have about 2 to 3 days off, right? And you have a little bit more time before or after work to study. So if you make time, you can execute this simple study plan. Okay, now finally, drum roll please. Time for the simple study plan here. Looking to cut your study time in half? Head on over to simplenursing.com/YouTube. You can sign up for free and get access to all of this.